Well, good afternoon, everybody.
Hello.
Thank you for being here today for our award presentation on such a beautiful day, actually, with all the other days we've had in this spring season. It's so wonderful to have a sunny day, and we are thrilled to be here today. My name is Cindy Samuelson. I'm with the Kansas Hospital Association, and I know a handful of you in the room, and I'm excited you guys invited us to take part in this celebration with you today. I'm here with Haley Finch-Ginsburg with the Kansas Hospital Association, and we are here for an award presentation about the work you're doing. But I thought I'd back up a little and tell you, who are these two people? The Kansas Hospital Association was established in 1910. It's an association for all the hospitals in the state. We have 125 hospitals in the state of Kansas. 82 of them are what's called a critical access hospital. And you guys, I know what that is. So we do serve a lot of rural areas in our state, and we do have a lot of urban members too. We're very thrilled to be working with every hospital in the state. That's one of the things, a lot of states don't have as much collaboration as we do here in Kansas, and I know we have Susan Page here with Pratt, and you guys have a lot of affiliations and collaborations as well. So thank you for inviting us. Now, this award is established by two groups. One is the Kansas Hospital Association, and the other one is our Kansas Hospital Education and Research Foundation. We call it KHERF, because we're all about acronyms in healthcare. So KHA and KHERF. And KHERF was established in 1969. Who's the math whiz? So what is this year for us? Yeah, 50 years. I know you didn't think you'd be here having to do math today. We're all about other healthy programs, but today also this is one of our first events to celebrate our 50th anniversary with our foundation. So over 100 years with KHA and 50 years with KHERF. We have a long track record of working with hospitals and healthcare, but this award has not been around as long. This award was established by KHERF in 2000, and I'll look, I think it's 2013. So we've only been recognizing what hospitals are doing in the Healthy Kansas Hospitals program since 2013. This is the 8th hospital to win an award statewide since that was established. So it's very exciting. You are getting this award this year with one other hospital in the state. Does anyone know what that is? It's Children's Mercy. You can see.
Oh, wow.
So Haley will talk more about the award, and I'm excited to introduce her in a moment. But think about that. Edwards County Medical Center and Children's Mercy winning an award for the two hospitals in the state. I think that's fabulous. This project was really a foundation-funded project, and it transitioned a little to a full KHA project in 2016. As I mentioned, I've been with KHA a number of years, since 2001, and have enjoyed working on this project since it started. And Haley's been with KHA 4 years, and I will tell you this was...
No, don't tell you.
Oh, okay, now,
Am I sorry?
But Haley will tell you more about her. This project, though, really is also a collaboration. We partner with lots of hospitals and communities around the state to do this. The program itself really was established to help hospitals look at food and beverage choices in the hospital, not just for patients, but for all of you, employees, staff, board members, visitors. We wanted to make sure there were options for healthy drink and healthy food in hospitals. And so that's why the program was established. And it really looked at not just cafeterias, but vending machines and other access to food and water that hospitals could really prioritize. We didn't want to just talk about it. We wanted to make change. So the program was really important to help hospitals with resources and tools, but also to help them change policy, so that really things that happen would happen through different changes in staff. There would be a policy there that would be strong. So right now, today, we have 82 hospitals in the state that have signed pledges to work on healthy food and beverage, which we think is fabulous. And we have 58 of them that have made policy changes like you guys have here at Edwards County Medical Center. So those formal changes, I think, are important because they last a test of time. So this year, I mentioned, we're very excited about the 2 awards we're getting. And I'm excited now to turn it over for you're waiting for her comments.
My passion is Healthy Kansas Hospitals. It's one of my beats.
I work in our education department planning our events, but Healthy Kansas Hospitals is truly an initiative that I have a passion for. I have a passion for coming out to these communities and truly making changes with you in partnership to gain wellness in community and in the facilities. So I'll tell you my story because Cindy was about to tell my story. But when I first started at KHA, this was the first hospital I visited. And coming into your hospital and getting a hospital tour and seeing how your community supports you and how you support each other in making changes was just remarkable. It stuck in my head. And as we were driving in, I was like, oh, I remember that. And then walking to the hospital and seeing the ambulance, I was like, I remember that. And walking down into the old hospital, I was like, I remember that. And I can't believe it was 4 years ago. And the changes that you all have made since then and the changes we've made and in partnership made together, just remarkable. Moving on though, I just think it's so important the work that Healthy Kansas Hospitals is doing. It's not only felt by you as staff, but it's felt by your patients, it's felt in your community. Reading your application that Crystal filled out, you spoke a lot about how you work with the school districts and how you work in the community with the Edwards County Health Organization and how important that is. Because just making changes in the hospital isn't enough. You have to get out in the community and work as a group and as partners. I think in general, hospitals have the potential to serve as powerful role models in the community by providing better and healthier options, education, and resources. This all improves the overall health of the patients, and that's our primary goal as healthcare workers and providers. I do now want to highlight a couple more projects. I did highlight your guys' work with the ECHO, Edwards County Health Organization, but I also want to talk about how you guys have worked with the school districts in the sports medicine area, and then also just establishing your committee. And then Crystal told me today, and it was in your application as well, that I really want to commend your leadership team. This does not work with Healthy Kansas Hospitals unless you have leadership support. It is the number one successful thing you have to have is that leadership support. And I commend Jim and your leadership staff of giving a budget, approving committee time, and also really supporting all the initiatives that have come forth through policy change. I commend you guys and give you a round of applause because without that, it's not possible. I'd now like to introduce Jim Hansel, Chief Executive Officer of Edwards County Medical Center, to give his comments. He did ask me how long, so if somebody needs to give him a wrap up, I'll put that on you guys.
You all know I'm a man of few words.
Yeah.
Quite a few words. I had some notes because I get nervous in front of groups, but one of the things I wanted to start off by saying is I really do congratulate Children's Mercy being the other recipient. You know, we're proud of the work that they're doing too, and they give us ideas and things that we can do to continue to get better as well. So congratulations to them, to their employees, and also their community. We know that a healthy community starts with us, and we knew that from the beginning. It starts in our homes, it starts at work. It's not just about food for us, it's about physical, emotional, and spiritual groundingness and wellness. We didn't set out, when I was being interviewed by the lady from Austin, I said, I want you to know that we didn't start this journey to win an award. We did it because we said it's the right thing to do, and we're going to do the right thing. And so we got involved in it. With that in mind, I got really excited to be able to appoint a couple people to take this on, to sit back and watch the committee leadership that they brought in from our two brandies. And brandy is not something we enjoy after work. They're healthy. When we talk about our brandy support, we have Brandy Wheaton, who is here in company, and our other Brandy. And I don't get in trouble for referring them to this way, but I call them Brandy Junior and Brandy Senior. Because they work right across the hall from each other. And the other one was a little bit quicker in having her baby than Brandy is, but both of them, if you don't know them. Brandy's home, just had a baby, and Brandy Wheaton is surprised she's still here. But I'm going to talk a little bit, but is there anything you want to say, Brandy?
It's just, like you said, it's kind of amazing to see the work that we've come together as a group of employees, and this has been amazing, and I thank everybody that's been on the committee that's worked together to do it.
Great, thank you. Well, they've done a great job. I think we should give them a hand, too. I set out to get something done, things get done. Both of them had an impact not only on the health of our community, the medical center, but I wanted to say thank you for also having an impact on the population increase of our county. Two more. We seem to have quite a bit of that going around. I don't know if you noticed. So I guess we really do have a happy and healthy team. When the decision was made to do more than just talk and flirt with these healthy ideas, we found that big things can be accomplished with little steps. You know, I look back and we've accomplished a lot of things. They took on pieces of this puzzle rather than having one big project. They wanted to touch this from a whole bunch of different angles. And so it gave everybody an opportunity to be a part of it somewhere, somehow, and to take this healthy life choice thing serious. You know, it did encompass putting healthy options in the vending machines, which go very quickly. Healthy options in the beverage machines. We used to just have cookies for everything, and now we provide a lot of fruit and healthier things that people can eat. Our breakfast options, our nutrition service team here, they really do, except for Tuesday mornings, they really do try to be pretty healthy. Tuesday mornings is our biscuits and gravy morning, and that's by Dr. Steckley's request. But we were already committed on this journey. We started seeing how the impact of what we were doing could maybe have an impact beyond our staff. So we're part of the community health needs assessment. Many of you were involved in that. And if you remember, out of our top 10 items, 4 of them tied in with healthy choices and healthy living. In fact, number 2 was obesity, and it was barely behind a concern for drug and substance abuse. So obesity was a major concern. Number 6 was fitness and exercise options in our community. Number 7, nutrition, healthy food options. And number 8 was our wellness and prevention programs. You know, you mentioned some of the things that we've done, and there's so many that go unspoken to, but we have really tried to work on water consumption. If there's events going on, we try to provide water. When the fires were going on down in the Ashland area, or when they were spreading around the area, it was Sandy's team that jumped to the rescue and tried to get out there and take water out to the people who were fighting the fires and things. And we've always tried to look at ways that we can do that. We've tied it in with so many different things. Fitness center use, STEPS program that we do. It seems like even March Madness this year, you couldn't just be a part of March Madness without getting a workout, especially if you were bad at it. Because every time you guys probably didn't know about this, but every time you didn't do so well in the March Madness thing, you had a series of exercises that you were tied in with it. So the idea was to try to pull us along, not just with the fun of March Madness, but to tie it in with healthy lifestyle choices. We give a lot of prizes away that are tennis shoes or athletic shoes and things like that. We go out for walks, we walked around, we picked up trash around the area. We had a ride a bike week. The first time we did that, it was like 105 degrees out. That was just brutal. And we had a few people, but when they rode their bike, they ate free that week and they ate healthy food. So that was kind of a fun thing. The ECHO program is going well. I'm pretty excited. Christy and I, our daughter Kaylee is real involved in the ECHO group and student reps and with the stuff that they're doing for tobacco free awareness in our community. So and as a hospital, we've taken that on as well. We are really active in that. We were even allowed to be featured in a webinar where people across the state can listen to us talk about our policy changes and things that we've done, all of us together. The school involvement, the PT summer conditioning program has just been a lot of fun to watch how that's grown and developed. Offering the healthy options at our hospital functions and meals, that's changed. The men and women's health fair always includes some kind of a wellness-focused prizes that we give away. Heather and her team have made sure that we give away some memberships to the wellness center here in the community. And another thing we did was we lowered the age that kids could get in. Imagine this, we had young kids that were 16 and under that were having to sneak in to be able to work out. We don't want them to sneak in, but we don't want them to get hurt. So they get a free coaching if they're going to be working out if they're 16 and under before they are turned loose. And I think that's been really helpful. It's very busy down there. The list could go on and on. Won't go too much longer. But thank you for all being a part of this special day. This is an amazing thing to be in the same category, and I can only imagine that Children's Mercy are probably going, wow, we're with Edwards County. Believe me, like that level too, because we kind of think we're special out here too. And we are because of all you guys getting involved. Thank you for the community members that have come to be a part of this, and providers that were able to sneak in. Mary was in and had to leave. Lisa's here, Dr. Winter's here, Dr. Mercy could not stay as a patient as well. Thank you. All of you are just such a big part of this. Thank you for KHA. They do a lot. We reach out to them often. They help through encouragement of programs like this to be able to recognize small hospitals that accomplish great things. And you guys certainly have. This is pretty exciting. So thank you. And Susan, thank you. As you know, our affiliation, our partnership with Pratt Regional has allowed us to dream bigger than we used to be able to dream and to bring new things and new adventures in. So thank you for that, Susan. And so if you don't know her, Susan is the CEO over there. I appreciate you coming over today. Larry is a vice president of our board, and I'm glad he's here today. Our board has been so supportive too. Anytime we want to do something that puts back into the community, they're nudging us. Yes, they want that, and so it's good. The board was very excited to find out that that encouragement has paid off with this kind of work. So thank you again for everyone that's been involved, and I guess that's all I have to say. So anybody else have anything they want to add?
Let's give a round of applause.